Hello and welcome. Today we'll be discussing primary sclerosing cholangitis, or PSC, a chronic and progressive disease affecting the bile ducts inside and outside the liver. Join us as we explore its causes, symptoms, diagnosis, and treatment options. The exact cause of primary sclerosing cholangitis remains unknown. However, it's believed to be an autoimmune disease, meaning the body's immune system mistakenly attacks its own tissues. Genetic predisposition and environmental factors are also thought to play a role. Notably, PSC is strongly associated with inflammatory bowel disease, particularly ulcerative colitis. While having inflammatory bowel disease increases the risk of developing PSC, the precise link between the two conditions remains unclear. In PSC, inflammation causes scarring and narrowing of the bile ducts. These ducts are responsible for carrying bile, a digestive fluid produced by the liver, to the gallbladder and small intestine to help with fat digestion. As the bile ducts become blocked and narrowed, bile backs up into the liver, leading to liver damage, inflammation, and eventually cirrhosis, a late stage of scarring of the liver. This impaired bile flow can also lead to recurrent infections in the bile ducts. Primary sclerosing cholangitis is a relatively rare disease. Its prevalence is estimated between 1 and 16 cases per 100,000 people. It typically affects men more often than women, with the average age of diagnosis between 30 and 50 years old. While PSC can occur in children, it's more commonly diagnosed in adults. The signs and symptoms of PSC can vary widely. Some individuals may be asymptomatic for years, with the disease only being discovered during routine blood tests or imaging. When symptoms do appear, they may include fatigue, itching, jaundice, which is yellowing of the skin and eyes, abdominal pain, and fever. As the disease progresses, individuals may experience weight loss, night sweats, and signs of liver failure such as ascites, a build-up of fluid in the abdomen, and encephalopathy, which is confusion or altered mental state. Diagnosing PSC typically involves a combination of blood tests, imaging studies, and sometimes a liver biopsy. Blood tests can reveal elevated liver enzymes, indicating liver damage. Magnetic resonance cholangiopancreatography, or MRCP, is a non-invasive imaging technique that provides detailed images of the bile ducts. Endoscopic retrograde cholangiopancreatography, or ERCP, is another imaging option, but it's more invasive and carries a higher risk of complications. Liver biopsy can help confirm the diagnosis and assess the severity of liver damage. While there aren't specific subtypes of PSC, the disease's progression and impact can vary significantly. Some individuals may experience a slow, gradual decline in liver function, while others may experience a more rapid progression to liver failure. The presence of certain complications, such as cholangiocarcinoma, a type of bile duct cancer, can also influence the course of the disease. Currently, there is no cure for primary sclerosing cholangitis. Treatment focuses on managing symptoms, slowing the progression of liver damage, and preventing complications. Medications such as ursodeoxycholic acid, or UDCA, can help improve bile flow and reduce liver inflammation, although its long-term benefits are still being studied. Regular endoscopic surveillance is essential to detect and treat any bile duct strictures or cancers early on. Ultimately, a liver transplant may be necessary for individuals with advanced liver disease. Unfortunately, there is currently no known way to prevent primary sclerosing cholangitis. Since the cause is unknown, preventative measures are difficult to establish. Maintaining a healthy lifestyle, including avoiding excessive alcohol consumption and maintaining a healthy weight, is generally recommended for overall liver health but won't necessarily prevent PSC. The prognosis for individuals with primary sclerosing cholangitis varies considerably. Some may live for many years with minimal symptoms, while others may experience a more rapid progression to liver failure. On average, the median survival time from diagnosis is around 10 to 15 years. However, this can be significantly improved with early diagnosis, effective management of symptoms, and timely liver transplantation. Research is ongoing to better understand the underlying mechanisms of PSC and to develop new and more effective treatments. Clinical trials are exploring potential therapies targeting the immune system and bile duct inflammation, offering hope for improved outcomes in the future.